All right, we are back with our candidate video sit-downs, and we have a little different twist here. We have a congressional candidate here for the 10th, the new 10th, and that's Stan Flemming. And Stan, well, I'm just going to let you tell people about you.
Sure. Well, thank you so much, Diedrich. Thanks for having me. Now, a little bit about myself. Grew up not far from here in a town called Steilacoom. One of 4 sons to my parents, who both were missionary physicians at the time, until my father was redrafted back in the Army for the Korean War. And we didn't grow up with a lot in terms of personal possessions, but my father taught us a lot of great values. And of those 3 values, of 1 being an asset to your community, and 2 being giving back more than you receive, and the 3rd being a servant leader, it was the 3rd one that really held true to me throughout my entire life. And why I chose to run for the 10th Congressional District is that I really do believe in the goodness and the greatness of the United States. And that's just not political rhetoric. That is something I truly, truly believe in. I also believe that we stand at a very critical crossroads right now with this coming election. It will be perhaps the most significant and the most important election that we as Americans ever cast in our lifetime, at least, because the ramifications of that election have far-reaching ramifications, at least for the next 10 to 20 years. You know, about my background, when we talk about having leadership back in D.C., I believe we need leaders who have vision, who have passion, who have commitment, and most importantly, who have experience, especially at this critical time in our nation. You know, my background is multifold. I come with a military background, having retired from the Army as a general. And that's going to be crucial for the 10th Congressional District because when elected to this particular seat, I will be the most senior ranking military individual in the entire United States Congress. That gives the people of the 10th District a seat at the table at the Armed Services, and as well as when it comes to the BRAC discussions that are coming up in 2015. That is significant, especially when we talk about jobs and the preservation of jobs in our communities. I also have a background in healthcare as a physician, having served in public health, private practice, academic medicine, healthcare policy and insurance, and healthcare administration. I have a very clear understanding of the issues and the challenges that face us in healthcare. I've also been in education as a professor and a university president. So I have seen education also from multiple views, along with having to share the K through 12 with my wife, who's a school principal. And then you add to that just the political experience that I bring from my state experience, my county experience, as well as being a city mayor. And understanding that the decisions that we make back in the other Washington have profound ramifications on those of us at the state, local, county levels, and most importantly as individuals living in our communities here in Washington State. So when we look at all the candidates that are running in this particular seat, it's very important to look at what is the experience factor, what is the depth of understanding of those issues that affect all of us, and it's not just political sound bites, but truly understand what those challenges are, and then having a path that leads us ahead in terms of addressing those and resolving those, and I believe I bring that to the table. So that's myself in a nutshell.
Okay. So let's get into some of the questions, and I'll just start from the list. And yes, you have seen most of these.
Yes.
And let's just start with number 1. What needs to be done to fix the healthcare system?
When we look at health care today, and especially I think what most people are taking a look at is the Health Care Patient Affordability and Protection Act. That is now before the Supreme Court, and the big question to all of us is what will the Supreme Court decide? And I believe it's anyone's guess in terms of what will happen. What it does have, should that bill be kept in its entirety with the mandates that are in there, it does not provide access to health care system, and it does not make it affordable. In fact, this bill will do just the opposite. 100% of the small businesses that I've talked to date have said if that bill is enacted as it's drafted, then they will either go out of business or they will drop health care coverage for their employees because it's cheaper to pay the fines than it is to try to pay the mandates. That is critical, especially when you're talking about young families that need to have that health care, or even the more senior members of our population who depend on having health care coverage. It's not that we need more money in our health care system. It's a matter of how we distribute that. When we look at U.S. healthcare, we're number 1 in the world for health education. We're 38th in the world for delivery and the quality of care we give our patients. And we're number 2 in the world when you look at GDP in terms of what we're spending per person. What we need to do is take a step back, and if I were in Congress, and when I am in Congress, I will work hard to repeal whatever's left of the current act, and not just simply throw it out, but really sit down at the table with the people who need to be there, and that is the healthcare providers, patient representation, and small business representation, and craft a meaningful healthcare act that really does address access and affordability, and that begins with lifting the Medicare caps that are on the residency programs, that keeps hospitals and other training institutions from educating and training primary care, so we have an automatic built-in shortage. So when you look at the 40 million Americans who don't have health care trying to access it under this bill, when you look at the baby boomers who entered our system last year into the Medicare system, and are trying to access to get a physician with their Medicare coverage and can't, we need to expand the role of primary care. And number 2, we need to look at how we reimburse. I will tell you right now, as physicians and other healthcare providers, we're paid on the number of procedures we perform on patients, not for the quality of time we spend with patients. So, that is a system that we need to turn around and start reimbursing the way we espouse to. And so if you take all these pieces and you line them up and you put them into place, we can start delivering, we can improve access, we can improve the affordability, and we can get back to what I would consider high quality, high yield health care for Americans, for all American citizens that are living here, without adding any more money. We don't need any more money in the health care system. It's just how we distribute that. Take it out of administration, take it out of needless procedures, and start paying for the time that is truly spent with providers, or with patients rather.
What is your position on our troops in the Middle East? Should they be brought home, or should we stay until the job is done?
That's a great question. And when you look at what brought us into the Middle East in the first place, it was to remove al-Qaeda leadership. That was the mission, that was the goal. That has transformed over time into nation building. I do not believe that we need to continue keeping our military presence in the Middle East, be it Afghanistan or Iraq, unless we are willing to do a couple of things. Number 1, we cannot downsize the force that's proposed under the current administration, the $487 billion cuts and the significant cuts to the military in terms of troops, the 100,000 troops, the 32 combat brigades, the 6 fighter squadrons, the troop transports, the 50 weapon systems. All those are lined up. We cannot sustain the presence that we currently have and maintain the global footprint that we have elsewhere. Either we, and then you add to that sequestration that kicks in January of 2013, and that takes the military below a level that allows it to sustain operations. So either we bring the troops home, or we increase the number of troops and sustain the presence. But when you look at what was the original mission of the military in prosecuting the war against al-Qaeda in the Middle East, mission complete and mission accomplished. So, in a nutshell, it is time to start bringing our troops home and reconfiguring, realigning, and resetting our priorities of what we want for our military in the future.
What do you plan to do to help our veterans deal with their health issues?
The current challenges that our veterans are facing with the current war has been, as most people read in the newspapers these days, is PTSD. And access to that. Part of that challenge is having access to resources that are needed, and it begins starting with identifying those soldiers who are in need of it, taking away the stigma that soldiers have who do suffer from PTSD but are fearful that that will have a negative impact on their careers if it's known, and allowing them to access the healthcare system that's available to do that. Part of that also is having an understanding. When I was back in D.C., 4 weeks ago, and talking with the Assistant Secretary of the Army, talking with the Assistant Secretary of the Air Force, and asking them how many soldiers today, how many airmen, how many sailors suffer from PTSD, they could take a swag at what they thought was accurate. And then I asked the question, now add to that the National Guard and the Army Reserves, Air Force Reserves, and the Naval Reserves. How many service members do we have now? They don't have a clue. because they don't track that side of it, yet we operate a total force in the combat theater. If we're going to be a total force in the combat theater, we have to be a total force when we're back here in the States and our service members are seeking care that they need. So it begins with identifying who they are, removing the stigma, and then ensuring that those resources are available. And part of that's going to be whether we provide it in the military or we contract with the civilian resources that are outside. Here in the 10th District, we have, if you go out to our communities, take Shelton, take Olympia, Lacey, Lakewood, Tacoma, we have the mental health services that are available for our servicemen to access. It's a matter of the military making those connections, making the commitment that they're going to fund and resource that, and then allowing service members to do that. So as a member of Congress, my commitment would be is to ensuring that, number one, when we look at funding for our veterans who have stepped up to the plate, who have answered the call of duty and served this nation with great honor, we owe it to them to provide those resources, and I would work very hard to do that.
Switching gears now, is education a priority to you?
Education has to be a priority, and absolutely it is a priority. When we look at kids who graduate from high school these days, 60% of our high school students will go on to college. Of those that go on to college, 40% of those drop out. 50% who graduate from college cannot find a job. And what that translates to is a couple of things. Having been a university president and having been a professor, I have seen firsthand how our students arrive from high school to college not prepared to meet the rigors of a college education and program. And then when they move on to graduate, they graduate with degrees that were very fitting for the 20th century workforce. But we live in the 21st century today, and that's a very high-tech, a highly competitive workforce, and the degrees that we're granting in our institutions today simply don't match those. If you go out and talk to businesses throughout the 10th Congressional District, owners of those companies will say, we have jobs, but we can't find the trained workforce to fill those jobs. So it's a matter of going back and looking at how we prepare kids to make it through high school. How do we prepare them in college, how we graduate. And a lot of that has to do with how do we set our priorities. Now, when you look at political sound bites, most people say education is important. But we do not identify, both at the state nor at the federal level, education as being a national or a state strategic priority. If you look at the national strategy, the document that drives everything that we do as a nation in terms of setting policy, nowhere in that document will you read education as a priority. Yet every nation outside our borders has that statement, funds that statement, and ensures that their kids in their system are educated, trained, because that is part of your strategic focus for the future of any nation, and we need to do that. My proposal would be is to start moving some of those federal dollars out of the federal level and push those down to the states, push them down to the school districts, so that we are financing and resourcing appropriately our schools for today and for tomorrow, and allowing the administrators and parents and teachers to be making the decisions that are appropriate to determine what are the priorities for those schools so that we start preparing those kids to do that. The second piece to that is aligning institutions of higher education and looking at degrees that no longer fit 21st century needs and rethinking what degrees are we going to offer our students, and then put those students into those channels, prepare them so that when they leave college that they are highly competitive, not just with the student who sat in the seat next to them, but they're highly competitive with the students they will never see or have met briefly because they came from overseas to sit in our schools to be educated. And those are the foreign students that come from abroad or stay abroad, but they are our competitors as we go into this 21st century. It has to be a very high priority for this nation.
I'm going to skip to my last question.
Okay.
Keep on time here. The new 10th Congressional District includes urban areas. You mentioned them, Tacoma, Lakewood, Olympia. If elected, how will you assure that rural areas such as Shelton, Mason County, will be represented equally?
There's two ways to address that. One is I happen to have a home here in Mason County, so I have a fondness for the county to start with. But how I would assure that is a commitment I would make to the people here, just as I made to the citizens that live in the 7th District that I represent on the county council. That district is split evenly between urban and rural, and the number one question people asked me when I was running for that office was, what will happen to those of us who live in the rural community? Will we have representation, or will it only be for the urban areas? When elected, we are obligated, we make the commitment to serve all the people regardless of where they serve. I see Mason County residents just as important as those who live in Pierce County or Thurston County, and I don't differentiate based on the density of the population. You know, each one of the needs of our communities are very unique and specific to those communities, and as an elected, I have an obligation to represent those interests for all the people. I will make the same commitment that I made to the people in my current district, is to represent the urban as equal as the rural. If you talk to my constituents who are in that district, they will say, hands down, that those who live in the rural have had equal, if not more, representation. And it's the same commitment I would carry to this district.
Well, Stan, thanks for stopping in. I know you're a busy man. Thanks for adjusting your schedule to fit into our schedule.
Well, thank you so much for having me and for allowing for this. I appreciate that. Thank you, Deidre.
And we'll be back with our next candidate in a few minutes.